PhilHealth, mafia, team behind Audit claims. Last of 3 parts. If allegations of Audit or manufactured medical benefit claims are true, how could hospitals be so brazen in defrauding Philippine Health Insurance Corporation, PhilHealth? This wouldn't be the case if no one from the inside is protecting them. Minguita Padilla, former head executive staff of former Health Secretary Janette Garin, told the Inquirer. The fraud in the healthcare providers will not proliferate, continue, flourish unless they have some help from the inside, unless they have conspirators, she said. A PhilHealth official, who requested anonymity for security reasons, said that every time someone new came in to head a state insurance company, a group of board members saw to it to bring to that person's attention the need to review PhilHealth case rates and the payments made, which the Commission on Audit has repeatedly flagged over the years. The official and his colleagues conservatively estimate that from 2013 to 2018, the public lost $154 billion due to PhilHealth overpayments and other fraudulent schemes. Documents obtained by the Inquirer shows that Health Secretary Duque was made aware of the problem in November 2017, a month after he took office. Ferrer, acting president and chief executive officer of PhilHealth, was informed about the matter a month after he assumed his post in June last year. Racket Despite calls for a review of the existing rates given to hospitals or to at least put in place safety measures, another PhilHealth official said nothing has been done. We all know that we're losing a lot of money. Why isn't there anybody who's in a position to do something about it not doing something? Said the official, who also requested not to be identified. One reason the racket persists, despite public pronouncements of accountability, is the existence of the mafia in PhilHealth, which ensures that there's no review of the rates and overpayments, the official said. And count of this supposed mafia, which he alleged is sadly composed of the majority of the executive committee, get what it wants. They gravitate and ingratiate themselves to the left square bracket PhilHealth right square bracket president and make sure that nobody else gets close. They befriend him and cater to his whims, he said. What happens next is that the mafia will turn the tables on officials who seek reforms in PhilHealth by accusing them that they are, in fact, the real mafia, he added. Culture of fear, the well-meaning officials, he noted, would then get suspended for various reasons, except for graft. Padilla said this was among the reasons some officials had opted to simply sit out the situation. There is a culture of fear. You can't blame them. Once in a while, there would be motherhood statements denouncing the fraud, but nothing happens. Those who really try to fix it, they get removed, end up being called troublemakers. I really feel sorry for them, she said. Even doctors and hospitals, she said, would not dare come forward to talk about the shenanigans going on in PhilHealth out of fear that their accreditation will be removed, thus depriving them of patients. It was really arbitrary. On a whim. It was awe-inspiring and scary. It was telling you that I could do this. So there's really fear, inside and out. No politics while she served PhilHealth toward the final months of the Aquino administration. Padilla said the issues hounding PhilHealth, to which she is helping shed light on, should not be viewed through the political lens. It's not a political thing. Those who want to reduce this issue to politics are doing this country a disservice and are so shallow. This has been going on for so many administrations. This corruption was never addressed the way actually as it should, she said. Padilla pointed out that, even during her tenure of just over a year, she tried her best to help address the problems that beset PhilHealth. Access to database for one. She helped cleanse its system by bringing down the number of people authorized to have access to its database from more than 11,000 to around 3,500. Those who were stripped of the access were found to be no longer connected with PhilHealth, a potential security and data breach. I was like a monkey wrench thrown inside because I was known as an anti-corruption left square bracket advocate right square bracket. We were able to look into these things, and some of the officers were actually happy that we were doing it. But some of the higher-ups stopped them from pursuing the punishment. Padilla said, referring to a number of senior vice presidents she did not name. Given that in its current situation PhilHealth is losing a lot of money due to fraud, Padilla said, it would be very dangerous once it was given more funds to implement the Universal Health Care (UHC) program. The danger with this is that, if a particular hospital made fraudulent claims in the past in cahoots with erring officials, the UHC funds leave from the start, Padilla said. Oversight body with a huge amount involved in the UHC, Padilla said there was a need to create an interagency oversight body, which will help curb medical insurance fraud, similar to that in the United States. She noted that when this United States oversight body was formed in 2007, it was able to curb losses due to fraud by 70%. An example of the things the body could do is to check whether dialysis centers are claiming reimbursements due them. It can easily be checked if the center is fraudulent, especially if it is able to do a number of sessions despite its limited number of machines, Padilla said. A patient needs to undergo a 4-hour session for dialysis to be effective. Unless we put safeguards to prevent and curb the corruption and money lost to fraud, then we will not achieve what we should achieve with UHC. We may be made to pay more than we should, unfairly, simply because the internal systems are not checked, she said. Premium contributions to health fund the UHC, the law provides that apart from revenues from sin taxes and allocation from the national budget, Philippine Amusement and Gaming Corporation and the Philippine Charity Sweepstakes Office, premium contributions will gradually increase from 2.75% in 2019 to 5% in 2025. The two officials interviewed by the Inquirer noted that President Duque must also designate proper officers, especially in PhilHealth Executive Committee, who not only understand the institution but also have the integrity to oversee the implementation of the UHC. Padilla said this was because the few individuals who are doing a disservice to the country destroy the spirit of those who wish to do good. Thank you for watching. Please subscribe.